In this module, we'll look at HSA contribution rules as it pertains to Medicare and Social Security. So now let's take a look at HSAs, Medicare, and Social Security, because when HSAs and Medicare or Social Security rub up against each other, the individual is no longer eligible to contribute to an HSA. So Medicare and HSA eligibility to contribute are mutually exclusive. So a couple things. It's about enrollment in Medicare, not eligibility for Medicare. So one has to be enrolled in Medicare to make themselves ineligible to contribute to an HSA. So when you look at on this chart here, Medicare eligible, really you're eligible, you can still contribute to an HSA. Bottom line is the one thing you can't do is use your HSA to pay your monthly premium, because you're not able to use an HSA to pay for premiums associated with a high deductible health plan. Now, when it comes to enrollment in Medicare, now you're enrolled in Medicare, you're no longer able to contribute to an HSA, but you are able to use your HSA assets to pay for your monthly premium and other costs associated with Medicare, which is a huge savings when it comes to taxation, because Medicare cost is one of the larger expenses when it comes to healthcare in retirement. Again, any enrollment, not eligibility, enrollment in any part of Medicare, even if it's only Part A, which doesn't have a monthly premium, makes one ineligible to contribute to an HSA. In addition, if someone's receiving Social Security benefits, they automatically are enrolled in Part A. So if someone is receiving Social Security benefits, they are ineligible to contribute any additional money into an HSA, and the reason is because they've already been enrolled in Medicare Part A, which makes them ineligible. Individuals who are receiving Social Security benefits are automatically enrolled in Medicare Parts A and B. Now, an individual can elect to waive enrollment in Part B. They can delay that if they're qualified, which we'll talk about. Enrollment in Part A when one is receiving Social Security benefits is not an option. Part A can't be waived. And any part of Medicare is going to make you ineligible to contribute to an HSA, including Part A. HSA, Social Security, and Medicare. A couple of things regarding this. The earliest one can receive Social Security benefits is at age 62. Okay, that would be at a reduced benefit. Now, the full retirement age for Social Security is when someone is entitled to full or unreduced benefits. Let's just say it's 67 years old, okay, and that is the case for those born after 1960. If an individual delays their enrollment in their Social Security benefits beyond their full retirement age, so they don't have to take it at full retirement age, they will be given an option for a 6-month retroactive payment of their Social Security benefits. This will have a big impact on whether or not they're HSA eligible up till the time in which they start to receive Social Security benefits. Medicare Part A enrollment, again, is automatic when Social Security benefits are received. Full retirement age for Social Security is that time in which you receive full unreduced benefits. For most people, it's going to be age 67. Okay, so when it comes to HSA contributions, you can make full contributions to your health savings account right up till the point in which you receive your Social Security benefits at full retirement age. Okay, so at age 67. If someone delays the receipt of their Social Security benefits to build up that Social Security benefit, it increases 8% each year past the full retirement age. If you decide, or if someone decides to delay the receipt of Social Security benefits past that age 67 in this case, there is a 6-month retroactive start date applied to one's Medicare Part A for Social Security. So as we mentioned, the minute you're enrolled in Social Security or receive Social Security benefits, you are enrolled in Medicare Part A and B. When you go past that 67, the full retirement age, if you get past 6 months past that, there'll be a full 6-month retroactive placement on your start date for Medicare Part A, which makes you HSA ineligible. And I say 6 months past because let's say you delayed 2 months past your age 67, there'd be a 2-month window or retroactive, okay? Because you're always going to be able to make your full HSA contribution right up to the full retirement age. Okay, so the important thing to note is that if someone delays the receipt of Social Security past their full retirement age, there will be up to a 6-month retroactive start date on Medicare Part A, so someone cannot contribute to their HSA in that up to 6-month window past that full retirement age for Social Security. When it comes to HSAs in Medicare, a couple things. It's about enrollment in Medicare. It's not about eligibility. So you can be HSA eligible and delay your enrollment in Medicare. There's a couple rules around that we're going to talk about. The big difference is when you are enrolled in Medicare, you no longer can make contributions to your HSA. However, you are able to make your monthly premiums on your healthcare, which would be Medicare. Okay, so you're able to use your HSA to pay your premiums on Medicare. When you're Medicare eligible and you are continuing to work, you're not able to use your HSA to pay your healthcare plans premium. Those are some of the differences. So again, it's about enrollment, not eligibility. So the initial enrollment period for Medicare is that 7-month window surrounding your 65th birthday. So if your 65th birthday is in May, it would be that period of February through August. Okay, you need to enroll in Medicare during that initial enrollment period unless you are eligible for the special enrollment period, for which then you can delay. And the reason this is important is because more people are working later in life. And if we have folks who are hitting that Medicare eligibility, they're happy with their health plan, they're working, and they want to continue to contribute to a health savings account, they're able to do that, but there's some rules surrounding it. So the first rule is you have to enroll in the initial enrollment period unless you are eligible for the special enrollment period. The special enrollment period pertains to Parts A and B and allows the delay of enrollment in Medicare without late penalties being assessed. The late penalty for enrolling in Medicare is a 10% penalty, and it's a penalty that is applied to your premium, and it goes on year after year. It never ends. So for each 12-month period that you have delayed, you have this 10% penalty applied to your monthly premium. So it can get very costly. It's a real costly mistake. So if you're eligible for the special enrollment period, you are able to delay enrollment in Medicare and stay on your health care plan. Now, the rule surrounding that is you have to be working, actively working, so you can't have retirement benefits. You have to actively be working and receiving health care through your employer or through your spouse's employer who's actively working for the employer. Now, also, the employer has to have 20 or more employees. And the reason for this is that if the employer has less than 20 employees, Medicare will be the primary health coverage and the health plan will be secondary, and that won't work. So the important thing for the special enrollment period is that you're actively working, or a spouse is actively working, that they have their health coverage through the employer, and on top of it, that employer has 20 or more employees. Okay, then at the point in which you no longer meet the requirements for the special enrollment period, you have an 8-month window to enroll in Medicare without any penalty. So that's how you delay your enrollment in Medicare and continue to contribute to an HSA, because that's our focus when we're looking at Medicare here. So similar to what we talked about with Social Security, when it comes to Medicare, you're able to contribute right up till the time in which you turn 65 and enroll in Medicare. Okay, now if you are eligible for the special enrollment period and you delay past age 65, there is up to a 6-month retroactive start date, again, for Medicare and Social Security. So if you enroll past age 65, there is going to be up to a 6-month window in which you're not able to contribute to an HSA. So here we have an example of Bob. Bob turned 65 right at the beginning of the year. He's able to make HSA contributions right up until through December. Okay. However, in this case, Bob's eligible for the special enrollment period. He decides he's going to delay and continue to work and have his health coverage through his employer. No problem. He's able to continue to make HSA contributions, other than he changes his mind in April and retires and enrolls in Medicare. In that case, his official start date for Medicare is in January, when he turned age 65, because there's a 3-month retroactive start date for Bob because he ended up enrolling in Medicare in April. He's not able to contribute to that HSA in January, February, March, or April. So if he did make contributions, he'd have to take those out. So here's our friend Bob again. Okay, this time same thing. Okay, he's able to make to take advantage of the special enrollment period. He delays enrollment in Medicare, stays on the company health plan, decides in September. You know what? I'm going to retire. I'm going to enroll in Medicare. He retires and enrolls in Medicare in September. His official start date for Medicare is that 6-month window through March. So he's not able to contribute past March. So he would have been able to contribute for January and February, but because of that 6-month window, he is no longer eligible to contribute to an HSA. If he did contribute, he'd have to pull that money out. One last thing with regards to enrollment in Medicare and the penalties. When it comes to Part A, most people are not going to face a penalty for late enrollment in Medicare Part A. Anyone who's worked 10 years, 40 employment quarters, 10 years is not going to receive a penalty. But for those who do, it's a 10% penalty that's applied to the monthly premium for twice the number of years that the individuals could have been on Medicare Part A but didn't enroll. Medicare Part B is really where the penalties come into play most harshly, and that is if you go past that 8-month initial enrollment period and you weren't eligible for the special enrollment period, there's a 10% penalty for every 12-month period of delay in enrollment that's applied to that monthly premium, and that's a permanent penalty. It never goes away, so you've just added 10% or maybe 20% or even more to your Medicare premium. So that's a huge penalty for Part B. Part D is applied where it's complicated. It's a late enrollment penalty. It multiplies 1% of the national base premium by the number of months that you were eligible but you didn't apply. So again, really Part B is really where it's at when it comes to the penalties, and those are significant. So a couple more notes on delaying Medicare. And the reason I spend so much time on this is because it comes up so often. To delay enrollment in Medicare without a penalty, again, you must be actively working or your spouse is actively working and has health coverage through that employer, and the employer must have a minimum of 20 employees. And it's very important that the individual be proactive to determine that they definitely are eligible to delay Medicare. In most cases, again, the health insurance company will not allow you to stay on anyway. And the other thing with regards to Part D is the prescription drug plan has to have credible coverage by the federal government in order to avoid a penalty for late enrollment in Part D, which basically means the coverage is expected to be as equal to what the Medicare prescription drug coverage is. So those are the things just to keep in mind one more time. If you still have questions with regards to this module, please email us at info@accesspointhsa.com.